Hello, everybody, and welcome back to our How To Corner. I'm Dr. Will Gray III. In today's episode, we'll be discussing knee overuse injuries. Before we get started, please like, share, subscribe, follow, comment, leave questions in the comments for things you want us to discuss, and we will definitely discuss them. With that being said, let's get going. The agendas for today's talk is going to be as follows: the anatomy of the knee, causes of knee overuse, common knee overuse injuries, symptoms, diagnosis, treatments, prevention strategies, and the long-term outlook from knee overuse injuries. Now, let's talk about the anatomy of the knee. The anatomy of the knee itself is pretty simple and straightforward. It's been studied for an extended period of time. And as a result, the structures are well known. The diagnoses as far as how to treat them, what they look like, are pretty well known. So this is just a basic background. The ligaments of the knee, your ACL, PCL, MCL, LCL, these are important in stabilization of said knee. You have tendons, your quadricep tendons, which is also considered your patellar tendon. And you have also patellar tendons that are actually in addition to your quad tendon. What I mean by that, you have your medial patella femoral tendon that keeps the patella in the joint itself or in the notch of the femur as well as the tibia as it moves. And then you have other tendons too that are a little bit more, how can I say, involved. But the cartilage of the knee, pretty straightforward. Your meniscus, those are the cushions between your knee or your spacers, or shock absorbers, as well as your articular cartilage. That's the cartilage that surrounds the bone. Now, the knee supports your body weight, absorbs shock doing all type of movements, as well as it tends to take on a lot of stress. So it makes it better, very, very, very susceptible to repetitive strain and how can I say micro trauma. Now, cause of knee overuse injuries. You have repetitive movement, running, jumping, cycling, somewhat cycling, depending on what type of cycling you're doing, as well as squatting excessively. Poor biomechanics, right? Malalignment. Maybe you have, if you're a lady, you have a pretty big Q angle, which leads to your knees being a little bit more medially tracked, or your actual knees having a little bit more medial stress on them. Super weak hips, flat feet, which is basically overpronation. That right there causes you to have some overuse injuries. Lack of recovery. You don't have the proper recovery. You don't rest enough. You don't have the proper footwear doing these particular activities, as well as you have training errors where you basically have an increase in training intensity and duration, or you don't have a proper rest to, how can I say this, return to training schedule, right? Now, the common overuse knee injuries are as follows: patellofemoral pain syndrome, runner's knee. Just a dull ache behind the kneecap. It just comes from improper tracking for the most part. Patellar tendonitis, jumper's knee, the tendon of the said knee, where you have stress through that part of your knee due to different things. Some of it is connected to weakness of muscles that are dynamic stabilizers that are around the knee. So as you tend to do an activity for an extended period of time, they fatigue. Now the activity itself tends to stress the patella tendon. Iliotibial band syndrome, just irritation of the IT band along the outer thigh. Also, there's an area down by your knee laterally that the IT band crosses over. There tends to be some friction that happens there also. I kind of link these next to together, bursitis as well as fat pad inflammation. You have bursitis or bursas in your knee that tend to become inflamed from different reasons, and it's usually repetitive stress. And then you have osteoarthritis. A lot of this is repetitive stress, genetics, weight related. So that's just a wear and tear of the actual joint itself over time due to overloading, improper loading. And like I said, sometimes just genetics. Now, the symptoms: gradual onset of pain around the knee joint, swelling, tenderness, and stiffness, pain during specific movements, running, climbing stairs, jumping, decreased range of motion or strength. Now, let's get to the actual diagnosis part. Physical examination of said knee. Check range of motion, alignment, and tenderness. In this world of healthcare, the physical assessments are not used as much as they probably should be unless you're in sports settings before you get an X-ray or MRI to confirm what you think has occurred. And a lot of times, the physical examination tools or special tests are hard to implement due to the fact that some injuries don't allow you to do so. Patients apprehensive, can't relax. There's too much tenderness. There's swelling. So some of those tests can be skewed a little bit. So imaging tests, MRI, X-ray, are used to rule out the ligaments as well as any cartilage involvement, as well as any fractures of any kind. Movement analysis, evaluation of gait or run and mechanics. When you have a person that has an actual knee overuse injury, there could be some substitution patterns or some protective patterns that became very prominent on the forefront because of the actual pain they're experiencing. So that adjustment in the gait or the movement mechanics needs to be analyzed or assessed to see if there's some things that need to be corrected possibly. Treatment and recovery, right? Now, the treatment and recovery part, this is very, 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 very important. I think there's a lot of misinformation, but I think there's a lot of consistent information too. And I think that it applies depending on what's needed, right? So rest and activity modification is super important. If you have a knee injury, you have to allow it time to heal and literally get treatment during this particular time. You can't just sit down and just hope it heals back up. It may heal, but then the weakness or the issue that caused the knee to have pain may persist. Ice and compression, right? Reduce swelling and pain. A lot of people like to think that the ice and compression model does not work or is outdated or whatever. If you have a rolled ankle, if you put ice on it and compress it, it will remove a lot of swelling out of the joint because that swelling impedes healing. Then you can start to implement some level of mobility back to the actual joint itself, whether that's some stretching, slight stretching, active range of motion, some resistive range of motion with bands, in order to try to overcome the injury as quick as possible by introducing proper blood flow and the replenishing of the joint with fresh oxygenated blood and healing factors. Now, physical therapy, strength, supporting muscles, quads, hamstring, hips. Pretty much that's what the focus is in physical therapy. And there are also some physical therapists that are very specialized in certain aspects of recovery. The biggest thing though is listening, right? If you get an input from a physical therapist, you need to listen, and then from there you need to share what happened and what you felt, what was the difference, what you noticed, because what you're doing, you're allowing them to help you help yourself. You know your body better than anyone, but if you don't communicate that with the people who have the actual answers, it's kind of hard for it to be helped, right? Now, stretching and mobility work, that's a two-way street there. Sometimes mobility is not your problem. Hypermobility is your problem, right? So if you're hypermobile, stretching not necessarily is going to be the thing that you're probably going to benefit from. You're probably going to benefit from a lot more stability, right? Trying to control yourself as far as being in those excessive range of motions that open you up for injury. Now, anti-inflammatory medication under professional supervision, yes, talk to your doctor about that. As far as what types of medications to be used, I've seen all different types. Some work, some don't. Really, kind of sort of, flip of the coin there. And gradual return to activity. Slowly build endurance and strength back up to return to activity. People do not do this consistently. This is a missing thing. It really, really affects said athlete or said weekend warrior or said everyday person from being able to return what they were doing prior to without having actual injuries going forward. Now, prevention strategies. Obviously, warm up and cool down before and after workout. Strength training. Get on a actual proper strength training routine and stick to it. If you're going to be active, proper footwear. Try to figure out what type of cushioning, type of shoes you need to wear. Or my favorite, get fitted for some custom fitted orthotics. Don't pay $600 for them, please. That's just ridiculous. Find someone who's going to assess your foot properly, get you an orthotic that's practical, that makes sense, that feels good, that actually gives you what you want, which is that protection or that actual comfort with movement. Cross training, maybe. We put this in here just to give you an option. I don't personally like cross training for everybody. I feel like it's a lot of movement that it's not necessarily appropriate for everyone, but some people do fit in this category. Definitely rest. Figure out your rest schedule. Put it in. You have to sleep, rest for your body to heal. And then not to mention listen to your body. When you have issues, soreness and stuff like that, get it addressed. Don't let it linger. There's not any one thing that works better than the other thing. What you have to realize, you have to figure out what works best for you, and then you have to continue that. But not listening to your body, it does not work. Now, the long-term outlook. Most knee overuse injuries can be fully healed with the early treatment. That is true. When you have a chronic cases, there's a lot of long-term management throughout physical therapy. You will probably have that issue as you do said activity, and you need PT as well as your MD in order to manage those type of issues that you're having. Preventive habits are essential to protect your joint health over time. Do preventative things in order to help cold plunges, hot tubs, making sure you're getting the correct nutrition in your body, rest, also understanding when it's time to, change just playing that one sport or doing that one activity. If you're a runner, you may want to try to bike or you want to probably try to just implement a whole different plane of movement when you're doing what you're doing. Don't just run flat surfaces, run heels. Just try to make sure your body's not getting in this chain of using those same muscles all the time. You want to get the other muscles as much attention or strength as needed. Now, if you made it to this point in that episode, thank you so much for listening all the way through. If you have any questions for us, you can find us on all platforms, as well as you can send us a message through our website, through the contact portal, or direct messages or DM us on Instagram, and we definitely will answer your questions. Thank you so much, guys, for listening. And again, I hope you have a blessed one. I'll catch you in the next one.